I saw many doctors cannot help me.
For what? What's the problem?
When I play tennis to serve and make toss the ball to the wrong position, and then I serve and then make injuries.
When was that? When did you injure it? So you were, it's a tennis injury?
Yeah.
Okay. Is that correct? Tennis injury? Okay.
Around.
Are you competitive or you're playing for fun?
You're playing for fun only.
Okay. Got it. Okay.
Around 2 years ago, 2.5 years.
2.5 years ago, you had an injury.
Yeah. Nearly 3 years.
3 years ago. Okay. Serving the ball in tennis.
Yeah.
You saw somebody obviously for this? You saw some doctors?
Yeah, many doctors.
Okay, what did the doctors tell you?
Just the bone in a wrong position.
Okay.
But they cannot help me.
Why can't they help you?
They only to make a massage or the shock or the something for me to solve the pain, but when I play again and then the pain again.
Right, and the reason why is what I'm seeing here is there's definitely some alignment issues. So my question is, how many doctors did you see?
Around 7 or 8.
7, 8 doctors.
Different kind of doctors.
Here in LA?
No, in Hong Kong.
In Hong Kong.
Yeah.
So you're coming from Hong Kong.
Yeah.
And you saw them there. Okay, and everyone told you that there's an alignment issue? They told you there's an alignment issue? The bone is out of alignment or the pelvis is out of alignment?
Yeah.
Okay, but all they could do is what? They could do massage?
Yeah.
So therapy? Therapy, yes?
Yeah.
Ultrasound? Do they do a
Ultrasound,
machine?
yeah,
Ultrasound,
machine.
E-stem, the pads? They did all that? Okay, and none of it worked or it helped?
Yeah.
Did it help any?
No.
Okay, and that's why you're here?
Yeah.
Got it, okay. Is there anything else going on?
This me my knee and the ankle and feel weakness of my right hand side.
Right hip, left knee?
Yeah.
Right hip, left knee, both ankles.
No. Right knee.
Okay.
And left ankle.
Right knee, left ankle, right pelvis.
Yeah.
And low back.
Yeah.
Okay, no problem. That's it?
Yes.
Okay.
I think so.
Okay. Well, what we're gonna do, we're gonna figure out kind of what's going on. We'll have you do a walk. We'll have you do a gait analysis. We'll see what's going on. We'll go ahead and examine you. There is something though, I see, you're telling me this injury was 3 years ago, right?
Yeah.
Something happened before that. He had a different injury. And
Yeah,
his original injury, I'm gonna say, is a good, when I'm looking at the shape of the spine and the disc, I'm like, your initial injury is 10 to 15 years old. Okay, it's not 3 years ago. Whatever happened 3 years ago with the tennis was a trigger. Now, what I mean by that is this. You know, I have people, they come and they say, you know, doctor, I just went to pick up the pencil and my back went up. The pencil didn't throw out the back. There was already a process going on, and that pencil was just a trigger. So in your case, and I'm going to show you, the tennis wasn't the cause. The tennis was a trigger for your original injury. You fell on your butt. He fell hard, so his sacrum is out pretty bad. And we're going to check the pelvis. I'm going to show you everything, okay? You think about it in terms of the initial injury. Regardless, we're going to fix what we can, okay? Anything else I need to know? No? Shall we get started? Okay, stand up and let's walk a straight line. Turn around. You're going to keep going, okay? Don't stop. Come here. Turn around. Keep going. And walk how you normally walk. So is this how he walks, normal? This is his normal walk? Okay. So what are some things that we're seeing as he's walking? He tilts side to side, first of all, okay? Stop there, march in place. Yes. Okay. Both his feet turn out, when he's marching. Is that his normal walk? Look at his feet. You see his feet go out like this. You keep marching that way. Is that his normal? His feet go out like that? Okay. So let's look at it. So that's the first thing. I'm gonna just place my hands here. Keep marching. No, I'm just holding you. Okay, I want him to close your eyes. Close your eyes, keep marching. Watch what happens. Okay? So that right knee goes back, or the right leg goes back, and then it goes forward. It goes back, and it goes forward. Do you see that? This is a pelvis issue. This is a sacrum issue. You see he keeps tilting to the right side. Slow down your walk. Does he always walk with his head down? So his spine's going one way, his body's going the other way. So let's start and see what we find. So the first one we're getting is actually his right atlas up top. Okay? So that's the first one I'm getting. Right side. Around T7, T8. T7, T8. Let's continue. So you can see now what I'm talking about. He should be like, that should be his normal. Ask him, does it hurt to be like this? It's uncomfortable to sit like this? It's a little difficult? Yeah. So all of it, it's all coming from down here. S1, S2. Okay, here, here, and here. Those are the three majors. Now, scoot forward, please. Go forward. Feet touching, feet together. And then you're gonna open and close the knees, right? Yeah. So watch my fingers. There. Right side only. Yeah. Left side only. Right side. Left side. And when he's doing it, you can see all these muscles are firing. Okay? These muscles are all firing because his posture is sitting far behind. If we do this, scoot back just a little bit, and watch this. If I put a curve, keep the curve in your low back. But you see, for him to put a curve there, his whole body comes back. Right? Keep the curve and open and close. Open and close. Right side only. See, he does the right, this fires. I'm saying these muscles are firing here abnormally. Left side only. Right side only. See? He's firing abnormal. Scoot back for me. Come back. Now let's figure out which pelvis. I said this is up and in, this is down and out, but now let's see which one is fixed. Here's the right, top of the joint, here, middle of the joint, there, bottom of the joint. That side's actually fine. Right there. A little bit on the left joint. Scoot forward, please. Forward. Now, this is what I wanted to show you. This is number 5. The injury at 5 was at least, like I said, 10 to 15 years ago. You feel this? But this is where it started, down here. You feel this one more? That right there. That's S1. So L5 is an issue, but his initial injury started down here. Okay, and we have a little fixation on the left pelvis. That's the first. Now let's continue. Scoot back for me, please. And let's feel. You can see, as soon as I get there, the changes in tissue, gets red, gets squishy, gets orangey, orange peel, like an orange, right there. More pain here or here? I feel there, yes. 1, 2, 3, 4, 5, 6, 7, 8, number 9. Okay, so we have sacrum, left pelvis, number 9. Excuse me.
But I feel painful from my right.
I understand. That's okay. There's a lot of times, again, we're not chasing the symptom, we're finding the cause of the problem. I've had many, not just me, a lot of us, we've had hundreds, thousands of cases where someone says, this side hurts. The fixation is there, he's been working this more. You'll tell us after we're done too. I'm getting the upper cervical. I'm getting 2 things. I'm getting C2, yes, and I'm getting C1 on the right. So critical atlas, we call it a critical atlas. I'll explain what that is. We have a critical atlas, C1, C2. We have T9, we have S1, and we have left pelvis. Here's what I want to show you. Okay. So this is the full spine. We're designed to have 60-degree curves. You don't have the curve. He has no curve in through here. Everything is straight, like I said, and then it goes back, just like this. Okay? This curve is decent. We can get a little more, but I'm happy with this part. This is the part I don't like. He's had a lot of multiple things. If you're comparing this to this, okay? This looks a lot worse than this one. This one looks better than this one. What this shows me is that whatever is out here caused a lot of postural shifts in his body. He also has a lot of digestion issues. A lot of digestion. He's not absorbing and assimilating his foods. We're going to talk about that a little bit later. Today the focus is let's get him started and get some relief and figure out the answer. Now, here's the initial injury. Okay, he has a bent coccyx, so I know he fell on his butt. And look here, this is not right. This is scar tissue. This was an old injury on his sacrum. Okay, that's an old injury on his sacrum, S1. And if we look here, this is the other thing. You know why you're feeling your right side? I'm going to show you right here. Your transverse, this is why you're feeling tight. It's not the cause, but it's why you're tight. So these are the transverses, right? These are the side, these are where the muscles and ligaments attach. Look at this nice space there. You have a nice space here.
Some space between.
What happened there?
Stick together.
And every time you turn is gonna
Yeah.
catch. That's what you're feeling.
So I have some sour and loose.
Correct. All of that, again, I'm showing you, starts here.
Yeah.
That's what we have to work on. Okay? So we get the sacrum fixed, the foundation, then all of this stuff is easy. Okay? Questions so far? Question? Have a seat, please. I just want to check your shoulders now. Over. That's fine. Okay. Walk once and we get started.
Cho hẳn cái này thấy.
Now, if we look at this x-ray, I need my glasses. You can see here too. But what I want you to see between this x-ray and this, come here. You have a good space here, you have a small space here. If you look here closer, this side has now become small. Okay?
You're getting worse.
Correct. So we need to stop that today, okay? You ready?
Oh, ready.
Have a seat, sir. Let's get started. To the right.
Cho con đỏ đi.
That's it. Good. And back. There you go. This is a seat belt, so everything is nice and firm. We'll start on C2. There we go. C2 has a PL. That's it. Beautiful. Now we can do the atlas. C1. No. Let's go over there. Let's go on the orange table. This hand down. C1. Setting it as an ASR. Good. There. A little more. Gotcha. Head down, please. Next thing we're gonna do is T9. Hands down, please.
繼續放低個頭。
So, 1, 2, 3. Oh yeah! Now next we're gonna do the pelvis, and then we're gonna continue from there. So
ที่หางที่ผม
we're gonna do the right pelvis. So we're gonna we're gonna do the left pelvis. Now this one is gonna be light. Okay, I'm setting it as a PIEX, we call it, posterior. And so it's gone down and out. I'm gonna bring it in and up. Just a little, then we get to the other one. Slide forward. There. Are you okay with this? Hold your wrist. Look at that. It's already moving. Good. Look at that. Gotcha. Come on up. Let's go back on the orange table. You're gonna hold lightly, okay? Light. It's gonna go up, you're gonna catch them.
Oh, okay.
Don't push them.
Okay.
Okay? Good. There we go. There we go. All right. Good. Gotcha. A little more. Gotcha. Still more.
佢叫你行嚟行去。
Slow down, slow down,
慢
slow
慢
down. Sit on the floor, please. Sit
坐
on the
喺個地
floor.
下度。
Okay. Now stand up. Is that different when you stand up?
有冇唔同到我感覺？再試多次。
Little different, right?
Yeah.
Okay. Can I continue? I have a little more stuff. Let's go over here. Tell me all the way down. Easy. Oh, you got a lot more. Down, down,
大啲。
down. That's a home run, sir. That was it. Come up slowly. Walk it off. Walk. Good. Watch his feet now. Come here, turn around. Okay, walk slowly. Good. Okay, sit on the floor again. Stand up. Stand on your right leg.
定係攞隻腳？定係攞隻？
Different? What's different?
I didn't feel painful.
There's no pain, right?
Yeah, but I feel the pressure on my knee.
The knee. We'll get there, don't worry. But in terms of the back and the hip, the pain is there, less or gone?
Gone.
Okay, cool. Have a seat, let's rescope and continue.
哦。
You feel it, right?
Yeah, I feel.
You see that? So now when he's sitting, what you can see is before, and when we compare, this whole part was behind. You look at his x-rays behind, look, now he's level. It's magic. You did come in with the Hong Kong waddle though, you know that. The waddle is when the pelvis does this side to side, they should go up and down. So we got to get rid of the Hong Kong waddle. Clear. Post adjustment, we did what? We did a critical atlas C1, C2. That is clear. We did T9. T9 is clear. Remember down here? We have a little bit there still, but not bad. Clear. Now watch this. All the way back. Come. Look.
Oh, he can lie more back.
Yeah, look. Come all the way back. Come back. Pain? Ah! Go forward.
看起来
Feet together. Open and close your knees. Open and close. Left side only.
ใช่ค่ะ
Right side. Completely different. Shoulders. And then I'm going to work on your knees and feet. You got an AIN femur. I'm going to go ahead and set your femur. There you go. Talus. Home run. That's it. Walk it off, sir. You're all set for today. That should feel very different now. And if you want, stand on your right leg and bend. Tell us the difference. Different? Less pain, no pain.
No pain.
You had it for 2 years, right? Good?
Good.
Okay. That's where we're going to start.
Thank you.
Welcome to the office.